Hey there, and welcome to The Explainer. Today we are diving deep into knee osteoarthritis. We're going to walk you through the absolute latest evidence-based strategies to help you manage pain and really get back to living your life.
You know that feeling, right? That stiffness when you stand up from a chair, or that deep grinding ache when you're just trying to climb a set of stairs? And if you've ever mentioned it to someone, you've probably heard this exact line. Oh, it's just wear and tear. It's a phrase that can feel like a life sentence, like your knees are just old tires that are doomed to wear out completely.
But what if that whole idea is just wrong? Let's reframe this for a second. Instead of thinking of your knee as a piece of machinery wearing out, what if you thought of it more like a garden or a plant, something that, with the right care and the right attention, doesn't just decay, it can actually be nurtured, strengthened, and made healthier.
And that's because, scientifically speaking, osteoarthritis isn't just about things wearing down. It's really an imbalance between your body's amazing natural process of breaking down old tissue and repairing it with new tissue. And the key word there is imbalance, because an imbalance is something you can influence. This is not some passive decline you have to accept. It's a condition you can actively manage.
Okay, so where do you start? Where do you even begin? Let's cut right to the chase and go straight to the most powerful, evidence-backed strategies. These should be the absolute foundation of any treatment plan. So according to pretty much every top clinical guideline out there, the first line, absolutely non-negotiable treatments are these three pillars. And notice what we're talking about here: targeted exercise therapy, weight management if it applies to you, and really understanding your condition. We're not talking about pills or injections as the first step. These three actions have the strongest evidence, by far, for reducing pain and improving how you move.
Now, when we say exercise, what does that actually mean? Well, the research is pretty clear that structured programs, say with a physical therapist, often get better results. That's especially true if you're dealing with other health issues where safety is really key. But let's be super clear on this. Unsupervised exercise is still incredibly effective. The most important thing, the absolute key, is just to get moving consistently and safely.
You know, there's this brilliant little phrase that just captures this idea perfectly. Think of the fluid inside your joints as being kind of like honey. If you let it sit for too long, it gets thick, stiff, and sticky. But what happens when you stir it? It gets smooth and fluid again. It's the same with your joints. Motion truly is lotion. And the flip side? Rust is rust.
Okay, pillar number 2, weight management. Now, for anyone with a body mass index, or BMI, over 28, clinical guidelines strongly recommend weight loss, and the impact here is huge. Even a pretty modest drop in weight can lead to a dramatic improvement in pain and function, and the evidence is crystal clear. The single most effective way to do it and keep it off is by combining diet with exercise.
All right, so you've established those foundational pillars. You're moving, you're managing your weight, but what if you still need more relief? Let's look at what comes next. See, treatment for this isn't random. It follows a very logical, stepwise ladder.
This is kind of how healthcare providers think about it. After those foundations are rock solid, the very first pharmacological step is often a topical anti-inflammatory. You know, a gel or a cream you put right on the knee. And that's because its safety profile is fantastic. If that's not cutting it, the next step up might be oral NSAIDs. That's stuff like ibuprofen. Always at the lowest effective dose for the shortest time. Injections? Those are usually reserved for really bad flare-ups, and things like braces can be incredibly helpful for taking pressure off specific parts of the knee.
So what about all the other treatments you're always hearing about? Let's do a quick evidence check, based on what the American Academy of Orthopedic Surgeons says. For supplements like glucosamine and chondroitin, the evidence is officially limited. It's inconsistent, though some people swear it helps them. Same story for platelet-rich plasma, or PRP. The evidence is limited, and while it might help with pain, we really need more research. Acupuncture also has limited evidence, but it may be an option to improve symptoms. And for dry needling, the experts reached a consensus that the evidence is just too unclear and inconsistent right now.
Now, this next part is just as important as knowing what to do, maybe even more so. Let's talk about some critical pitfalls. Treatments that are either just not effective, are pretty risky, or are frankly just bad advice.
This first one is a really big deal. Major clinical guidelines strongly recommend against arthroscopic surgery. You might hear it called a clean-out or a washout, if your main diagnosis is just osteoarthritis. Why? Because really high-quality studies have shown it's no more effective than a placebo or a sham surgery.
And here's another strong one from the guidelines.
Oral narcotics, and that includes tramadol, are just not effective for improving long-term pain or function from osteoarthritis. What's worse, they come with a really high risk of serious side effects and dependency. The bottom line is, the risks completely outweigh any tiny potential benefit.
And this probably hits home for a lot of you. This highlights a huge gap we often see between what the evidence says and what happens in reality. Simply being told to go exercise is not a treatment plan. For exercise to actually be effective, it needs to be structured. That means getting a specific program or, even better, a referral to a physical therapist who can give you the right exercises for your body and your specific situation.
Okay, so we've looked at what to do, what to consider, and definitely what to avoid. Let's pull all of this together. This isn't about finding some magic cure. It's about having a clear, evidence-based path forward that puts you firmly in control.
So here's your takeaway toolkit. First, and maybe most importantly, completely reject that wear and tear myth. This is a manageable condition. Your most powerful tools, your secret weapons, are exercise and weight loss. Those are your foundational moves. Remember that treatment follows that logical stepwise ladder, always starting with the safest and most effective options first. Know what to avoid, like those ineffective surgeries and risky meds. And above all, remember this: you are in the driver's seat of your own health.
So we'll leave you with this final thought. It's so easy to feel overwhelmed by all this, but progress, real progress, starts with a single step. Looking at everything we've covered, just ask yourself, what is one move? It could be big, it could be small, but what's one positive move you can make today to start tending to your garden and taking control of your knee health? Thanks for joining us.